Welcome everyone to today's webinar, The State of Nursing in 2023. On behalf of Becker's Healthcare, thank you so much for joining us. Before we get started, I'm just going to walk through a few quick housekeeping instructions. First, we'll start today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions that you have throughout the webinar by typing them into the Q&A box that you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link that you used to log into today's webinar to access the recording. If at any time you don't see your slides moving or if you have trouble with the audio, first try refreshing your browser. And you can also submit any technical questions into the Q&A box. We're here to help. With that, I am pleased to welcome today's speaker. We have with us Dr. Iman Abu-Zaid. Iman is a medical doctor with an MBA from the Wharton School of the University of Pennsylvania, a McKinsey alumna and a software product manager who 5 years ago founded Incredible Health, which is the fastest growing career marketplace for healthcare workers in the U.S. and is used by more than 650 leading hospitals today to hire permanent nurses. The company is the highest valued tech-enabled career marketplace for healthcare workers, and Iman is one of 4 Black female founders to be running a company valued at over $1 billion. Iman, thank you so much for being here today, and I will now turn over the floor to the Incredible Health team. Thank you.
Awesome. Thanks everybody for jumping on. My name is McKay Allen. I'll be walking through the presentation with Iman. Iman, thanks for joining us today. I know you're very busy, and so we appreciate you taking time to help us with this presentation.
Yeah, thank you for having me.
Okay, so we're gonna just kind of walk through this agenda you see on your screen here. So we're gonna talk a little bit about the nurse labor market today. We're then going to reveal, for just the second or third time, I think, in a broad way, results of our nurse study that we just completed in Q1. There were about 700,000 nurses that there's data that is included in the study from those nurses, in addition to surveying about 3,000 nurses. So there's some really interesting data we're excited to share with you, and then we'll take questions. So if you do have questions, go to the little Q&A drop down. We'll address those throughout, and then we'll also address those at the end as well. So let's dive right in and talk a little bit about the nurse labor market today. So 1 in 8 Americans working in healthcare. We see this because the demand for healthcare is going up, but the number of workers available for healthcare is not meeting that demand and matching that demand. This is something that isn't new, but it is something that seems to be accelerating, Iman. Is that fair?
Yeah, it absolutely is accelerating. The nursing shortage was here long before the pandemic. Obviously, the pandemic made it a little even tougher, and it's projected to continue for many, many decades to come.
Yeah, so this isn't something that's just going to dissipate. That's something that I think is important to note. It's getting worse. It's estimated about 1.1 million nurses short by the end of 2023, 18.7% average annual acute care nurse turnover. And then the one that surprises me every time I see it is the 89 days average time to hire a permanent specialized nurse. That number is startling to me every time I see it. Do you see that as a surprising number? And as you talk to CNOs and leaders in hospitals and health systems, does that number surprise them, or is it consistent with what they're seeing as well?
It is consistent, especially when you're looking at acute care nurses and specialized nurses that are experienced as well. Many hospitals are averaging 80 and 90 days for those roles. It's a very concerning statistic. So imagine it's taking 3 months to hire every nurse you need for the ICU or for the OR or for the ED. And now our goal for when employers are using the Incredible Health Marketplace to get that to 20 days or less. And usually the savings of driving hiring in permanent nurses faster, so it's filled in 20 days instead of 90 days, tends to drive dramatic cost savings, because the hospital and health system can reduce the number of temporary or travel nurses that they have and increase the number of permanent nurses, which helps the health system financially and also helps reduce burnout for the nurses too.
Yeah, that's great. And that's one of the, I mean, those are the biggest value props that we see, right? Is Hospitals and health systems that are used to 90 days to hire permanent nurses can suddenly, with the Incredible Health platform, do that in less than 20 days. And that's a huge cost savings and a huge time savings. And we'll come back to that and talk about it a little more. But why don't we dive into the study and talk a little bit about the study itself. So how many years has Incredible Health conducted this nurse study, Iman? Is this the third or the fourth year?
This is the fourth year. This is the fourth year we run this study, and we publish our results. It's always around, March, April, every year. Honestly, when we started this 4 years ago, it was because there wasn't an enormous amount of data on what's going on with U.S. nurses, and consistently year over year have continued to do it. And with events like the pandemic and the ongoing nursing shortage, and just we all operate in healthcare, which is a very dynamic environment and a very dynamic market. We learn something new every time we run this study.
That's great. Let's talk a little bit about the study parameters too. So data from 700,000 nurses, as I said, and then 3,000 nurses that directly answered a survey. And this is really recent data. So this isn't like 2-year-old data or a year old or even 6-month-old data. This was gathered in mid-March. So this is brand new data, hot off the presses. Anything else you want to say on the study parameters before we dive in, Iman?
Yeah, so the benefit of, when McKay mentioned 700,000 nurses, the benefit of being a two-sided marketplace that's enabled by software is you have access to an enormous amount of data and information. These are nurses that are registered on our platform. They are filling out profile information, and so we're able to see a lot of hiring activity on our platform as well and track that too. And so we're in a unique position to be able to really draw insights from our network of nurses, as well as all the hiring activity on the platform.
Yeah, that's a great point. This is data that is proprietary, and we're in a really unique spot to gather it and present it to you. So that's what we're excited about today. Okay, I'll just kind of review these, and then you can comment on them, Iman. So some big picture pieces of data here. 80% of nurses say they plan on staying in the industry until retirement. That is up from 55% last year, which is great news. That number increased dramatically year over year. But still only about half, 54%, would recommend nursing as a career. Those numbers, when I first saw them, seemed not contradictory, but like kind of telling slightly different stories. What do you think? Like, what can we read into these two pieces of data, Iman?
Yeah, so the good news is that we have fewer nurses that want to leave the profession altogether, right? Especially compared to last year. And so that's definitely good news. But what these numbers don't tell us is what's going on with turnover and whether nurses are changing jobs within nursing. And those turnover numbers have certainly improved compared to last year, but they're still higher than any of us would like. They're still over 20%.
Interesting. And then does it surprise you at all that about half would recommend nursing as a career to somebody else? Is that where you would have expected it to be?
Yeah, I think that is where I expected it to be. I hope in the subsequent years that percent goes up. I mean, the truth is that the demand for nursing from Americans who want to go into nursing is actually at an all-time high. I mean, the number of applicants into nursing schools is in the tens of thousands. In fact, there's wait lists to get into nursing school. Unfortunately, we have this bottleneck around nursing schools where they don't have enough faculty or enough facilities to train more nurses. So even though not every nurse is recommending the profession, it is a very popular profession because the amount of education you need, especially, and then compare that to the salary you get, the math equation is really strong and positive.
Interesting. So there's a ton of actual supply at the top of the funnel, if you will, of people that want to become nurses. But then the process to get them educated and eventually hired is where there's a lot of inefficiencies, I think is kind of what you're saying.
Yep.
Okay. All right, let's talk mental health. So mental health is relatively steady year over year. That's not necessarily good news, and you'll see why here in this next bullet point. 25% of nurses in 2022, when we did this survey, said they were in good mental health. This year, that number essentially stayed the same, went slightly up to 26%. So maybe some good news, bad news. Like in the past, it had been dropping, so it looks like it's stabilized, but it's not exactly going up and to the right. It seems to be settling in that relatively low place. Thoughts on this? Did this surprise you? Good news, bad news for this statistic?
Yeah, this is definitely problematic. The good news is it's not getting worse. The bad news is that it's not going up, right? It's not improving. It's not sustainable. For that, this means 74% of nurses are delivering care while not being in a good state of mental health. And we see that play out in many ways, in burnout, in turnover, in honestly the suicide rate, and and other mental health conditions where nurses are more susceptible because of their profession.
Interesting. And in the past, this number had been higher, and it had come down to this 25% number, which is interesting. Okay, so lack of speed is how we categorize this. A majority of nurses, around 84%, which is a lot more than a standard majority, believe the healthcare industry is not acting quickly enough to address their main concerns. This was, I think, a startling question for many, and we talk about exactly what they're concerned about, and we'll address how health systems can respond. But the overwhelming consensus is these nurses feel like that there's not enough being done quickly enough to address their concerns. Reaction to this statistic, Aman, is this consistent with what you hear from as we talk to nurses using the platform, but also hospital leaders and administrators?
It is. It speaks to a crisis of confidence that we have in our industry, in healthcare. And when we're, us collectively, whether you're a hospital or health system, a technology vendor, a leader, it's taking too long to address their concerns. And we really do have to spend more time earning back some of that trust and make impact faster in order to improve the experience of healthcare workers.
From your seat, do you think this was this erosion of trust, if you will? Is this something that started with COVID, or did COVID exaggerate it and make it worse and maybe make it faster?
Yeah, I think, look, when we have run the study even before COVID, right? And so it wasn't in a great state even before COVID, that level of trust between healthcare workers and their leaders. But COVID certainly accelerated and exacerbated the issues as well.
Okay. All right, let's talk about the main factors that kind of lead to that lack of trust, and actually factors that impact retention and obviously attrition. So 73% of the nurses say they're concerned about staff shortages. 70% say they're worried about personal burnout. 68% say salary and benefits are a major concern. And then there's kind of a breakage in the data. So you see those three are pretty grouped. And then you drop all the way to 45% who say work environment, scheduling issues, and limited career advancement. Aman, are there any of these that jump out to you? Staff shortages doesn't surprise us. We hear that all the time. Personal burnout, especially with the macroeconomic climate, I think has an impact in that. But any statistics on here that jump out to you? And does it surprise you that there's a bit of a breakage between the top three and the bottom three?
Yeah, I know that definitely it's not surprising and consistent with what we hear qualitatively and anecdotally as well from both nurses and from hospital leaders. The question, the tough area is, what are we going to do about it, right? And the good news is that there are a pretty clear set of tactics and solutions for each and every one of these. Let's take the example of the scheduling one. I mean, the scheduling issues being a major concern is the fact that the 12-hour shift full-time role only is no longer enough, right? We need to offer more part-time options, more self-scheduling options, 4-hour shifts, 8-hour shifts, weekend shifts. Like, it essentially needs to turn into a menu of options for nurses in order to help them fit their work life, their lives into their work, and vice versa. So there are very clear tactics for addressing each of these, but the number one being addressing the staff shortages, which means we need to be able to hire nurses more efficiently and faster, retain more of them, so we don't have to deal with the staff shortage and burnout that comes with that, and honestly, overall, just increase the number of nurses that we have that are experienced and specialized in this country too.
And we'll talk in the next, let's see, 5 or 6 slides about these and how we can address those. So staffing shortages, let's dive into that one specifically. This is easily the number one concern, as we talked about. 93% say that staffing shortages have actually worsened over the last year. So even though everybody's been aware of it, it still has continued to get worse. What are the things you're seeing as the main causes of this, and then potentially a few ideas for hospitals and health systems to start to solve some of these problems relative to staff shortages, Aman?
Yeah, so insufficiently staffed floors is dangerous, and then no nurse wants to feel like they can't deliver high quality care, and they're simply all put in many of them are put in a position where they have to deliver too much care, which is leading to the burnout. But in addition to things like looking at ratios, what's reflected here is also the impact of travel nurses, who generally make 2 to 3 times more than permanent nurses. And when you have more travel nurses on the floor, that does, yes, it alleviates some work, but these are also nurses that are newer to the health system, so they may not know the nuances and the processes and the personalities and so on, as far as getting how to quickly get their job done. And then the other thing is that we're seeing an increase of inexperienced nurses on the floors as well. And so the ratio of inexperienced to experienced nurses has changed, and we simply do not have enough experienced nurses on the floor. And so that also is problematic, because new nurses require, or less experienced nurses require, more oversight, and that work is being hidden or not counted for experienced nurses. They actually have to do more work. If you're an experienced nurse on a floor that has lots of new nurses, you actually have to do more work, because you have more colleagues that are less familiar with what they're doing.
And isn't there some, we've also done studies, and I don't know if it's in this presentation exactly, but where there's always some morale or frustration issues when the permanent nurses when they're constantly faced with inexperienced and travel nurses who they know are not there for the long haul. That adds to the frustration and feeling of being burnt out and short staff concerns as well.
That's right. I mean, culturally, having lots of travel nurses on a unit is a very difficult situation, because essentially what's happening is, let's say you're a permanent nurse in the OR, the ICU, you have a travel nurse on the unit as well. Who's making 2 to 3 times more than you for doing the same job, and that's a difficult situation for anyone.
Interesting. So there's a ton of factors there. So compensation gaps, this was one of those top 3 that nurses mentioned. Only about 33% of nurses say they're fairly compensated in the roles. 65% say they've at least considered or thought of about a shift to a travel nurse role, primarily for a pay increase, which I think leads kind of from exactly what you were saying, which is they see these travel nurses come in and they say, gosh, maybe I'll get in on that. And that just continues to erode what happens on every floor at every hospital and every health system. But I do think it's interesting that only a third of nurses say they're fairly compensated. I had someone tell me once that if you don't feel like you're fairly compensated, that's kind of all you're thinking about. This has to have an impact on the morale and the burnout rate as well.
Yeah, the reason this is happening is just, it's classic supply demand, market dynamics. So when there's a shortage of labor, wages go up, right? Or wages need to go up. And but unfortunately, hospitals and health systems, they don't have enough. There's not enough funding and money to pay everybody pay every nurse like a travel nurse. And hospitals do run on very low margins, very, very low margins. And so, it's a very unsustainable situation for a hospital or health system to have lots of travel nurses, or to compensate permanent nurses like a travel nurse too. And so the main solution here is to hire more nurses and retain more of them. And with that approach, then the hospital is able to afford their nursing staff. It is, the other thing is, there is perception going on here too. So compensation isn't just about the hourly rate, it's about the whole package, the perks, the benefits, the 401ks, the retirement, it could be sign-on bonuses, the retention bonuses, tuition reimbursement. There's just a whole menu of additional perks and benefits that nurses are offered as well in many hospitals and health systems. So they are often encouraged to look at the full package, not just focus on the hourly rate.
So there's a couple of questions about compensation that we maybe should have just addressed now while we're going through. So um, Michelle asked, how do you recommend that hospitals combat, like, how do you deal with housing shortages in the markets that you're in when you're trying to recruit? Because if a nurse can't, move to an area and afford a home, it's pretty hard to recruit them. There's some creative ways that, with signing bonuses and things like that, that you might be able to help. But have we heard that from the nurses or the hospitals that use the Incredible Health platform that, some of these markets where housing is really expensive, it can be hard to get people to move in from a different area?
Yeah. So probably the perk that we've seen implemented well, and it is effective, is to offer relocation assistance, which is usually on average about $5,000. That's the usual relocation assistance package that we see. And historically, relocation assistance has been only for executives, for nurse leaders, but increasingly it's being offered for experienced nurses, for experienced staff nurses as well, in a whole range of specialties. At the end of the day, the permanent nurse labor market has a huge amount of geographic mobility. Even on our platform, 1/3 of the nurses that are hired hired locally, another third are moving within their state, and then another third are relocating to a different state altogether. So offering things like relocation assistance tends to help or alleviate the friction that comes with relocation.
And we've done research as well that indicates nurses are more willing than ever to move for a role. So it's not something that they're going to be shy away from doing in many situations. Signing bonuses and salaries. So
sorry, McKay.
Yeah,
One other thing I want to mention is that when we're looking at the topic of compensation as a hospital leader, we do have to even if you can't necessarily increase the hourly rate, there are other perks that that help and that help retain nurses and help hire them. Things like offering on-site childcare or reduced cost of childcare, having a really robust benefits package. We do have hospitals and health systems that offer housing or reduce housing costs and stipends for housing too. Programming for career advancement, offering flexible schedules for shifts. All of these. At the end of the day, the nurse is evaluating the full package, and so even if you can't necessarily increase the hourly rate right away, or it's going to be, hard to do that, these other perks tend to go over well with nurses too.
That's interesting. So it's not, there are things that nurses are going to value potentially just as much or more than just a straight up increase in the actual amount you're paying them that could actually add to the overall value they see in the package you're offering, which is great. One of those things I think is the signing bonuses. 48% of all nurse offers now include a signing bonus. That's a 14% increase over last year. And the average bonus is almost $12,000, which is 8% higher than last year. The thing that's cool about a signing bonus as well is these nurses get that chunk of money right away. And like it or not, like economists might disagree with me, but getting $12,000 feels like more money than getting an extra $500 twice a month in your paycheck. It just does. And that allows them to do a lot of things with that money that maybe they've been putting off. So it's really appealing that when they sign on the dotted line, they're going to get that money. I think this kind of speaks to what you were just saying. This is an example, a wonderful example potentially of health systems and hospitals being creative with compensation packages for nurses as they try to get them to join their system.
Yeah, the truth is, it's sometimes, as a hospital leader, it's sometimes easier to get approvals for sign-on bonuses than it is to increase the hourly rate for all nurses at your health system. And so it is certainly used as a tactic, and as we can see, it's increasingly used as a tactic, where 48% of the offers on the Incredible Health platform that we're seeing do include a sign-on bonus. The other thing is, like, the way they're structured varies. So sometimes, like as you described, McKay, they are a lump sum upfront, and then other times they are stretched out based on retention, right? So you get maybe half upfront, but another half happens at 1 year of service or at 2 years of service. And so that's one sort of approach that many health systems are taking. Again, we're seeing the use of sign-on bonuses increase not just for nurse offers overall, but particularly for experienced nurses and for specialized nurses. It also, sign-on bonuses also encourages relocation. I mentioned earlier that the hires on our platform, 1/3 are relocating from a different state. And so sign-on bonuses sometimes are used to cover relocation costs if a separate relocation assistance package is not necessarily included.
That's a great point. You talked about this opportunity and flexibility. Cross-training is becoming very, very important. And then 96% said self-scheduling mattered in their consideration of a new position. This is, I think, a huge deal and buys you a ton of goodwill, and is almost required at this point, given by the evidence by the 96% stat there. Self-scheduling. Explain how that works, how hospitals are using it, and why it matters so much to nurses, Aman.
Yeah. So look, self-scheduling is matters, of course, to the majority of nurses, as you can see here. And it's actually something that I think should be promoted even more by hospitals and health systems if they have it. What that means is that, giving the nurse the ability to schedule their own shifts, right? And it doesn't have to be necessarily done with some fancy piece of software, even though there is like amazing software solutions for self-scheduling. Sometimes it's just done with pen and paper. The key here is that the nurses want choice, right? They want the power and control over their schedules. Because at the end of the day, we have 5 generations of nurses in the nursing workforce today, from Gen Z all the way to the baby boomers, and they have a variety of needs. We have nurses that are caring for children at home. We have nurses that are caring for elderly parents, and we are seeing the desire for more flexibility, particularly among Gen Z and millennial nurses, really be like it's very consistent, honestly, even with other industries. Like, it's not just nursing. Gen Z and millennial employees, American employees throughout all industries are looking for more flexibility. And so creating that level of autonomy does tend to go down well. It also helps with retention, not just with hiring. On the topic of cross-training, many hospitals and health systems offer cross-training to the nurses that are already there. So essentially, they're offering it internally. What we're seeing more and more of is hospitals and health systems offering cross-training opportunities externally. So for example, let's say you're an ED nurse, you've already spent 1 or 2 years in the ED, and you have this dream and desire to work in the ICU. More and more hospital and health systems are hiring that ED nurse into the ICU and offering the cross-training program to them so they can switch specialties. Cross-training programs tend to be shorter than training a new graduate. And again, they're another tactic to drive up more hiring in nursing and also to drive up retention.
Well, let's talk about retention strategies. So these are things I think that people can be proactive with. So career mobility, planning and flexibility, sustainable patient to staff ratios, creative and robust compensation packages, and then mental health support and burnout prevention tools and methodologies. Should we go through each one of these? You mentioned career mobility, planning, and flexibility. People want to see like a path. They want to know that they have the ability to grow and change in their career. How are hospitals facilitating this? Because we've seen some really cool and creative solutions that are being tried out here for career planning and mobility.
Absolutely. So the first is like strategically recognizing that nurses want a whole. There's so many a variety of preferences among the nurse force, right? We have some nurses that want to go from they're new graduates and they want to specialize right away. We have nurses that want to cross-train to other specialties. We have nurses that want to go into leadership. We have nurses that want a hybrid role. That's not just at the bedside, but bedside plus informatics or bedside plus operations. And so the key is to put into place strategies and tactics that can account and recognize that variety. Probably one of the most effective tactics we've seen is career mobility planning. What that means is that, say at day 120 after the nurse starts at the organization, there is a documented career mobility plan for that nurse that he or she agrees to, as well as their manager, as well as HR, and where it's very clear how the nurse is going to evolve their career at that hospital and health system. And so not leaving it up to chance and not leaving it ambiguous for how they're going to evolve and how they're going to advance their careers at the system. Going along with that is flexibility, right? So one of the most asked about things from nurses is, I need a more flexible schedule. We talked about self-scheduling, but we are not now seeing more hospitals and health systems offer a menu of options when it comes to scheduling. 4-hour shifts, 8-hour shifts, weekend shifts, part-time options, full-time options. Yes, it's much more complicated to manage operationally for the nursing leaders, but we have to meet the talent where they're at. And that includes the talent that's already, at your health system, as well as those you're trying to hire.
Those are awesome things. For the mental health support, I think it kind of is the underlying or maybe overarching, depending on how you look at it, question here is like all of these concerns add up to what we saw with the mental health statistic. What support, what resources are there for both nurses that they can get on their own, but also that hospitals and health systems can provide to their nurses to help with their mental health, which impacts burnout and everything else?
Sure. So we are seeing increasingly more hospital and health systems offer mental health support, formalized support, including therapists, coaches, psychiatrists that nurses can see. And they also have implemented, a range of different facilities for this as well. So they have quiet rooms and meditation rooms and things like that as well. Now, at the end of the day, like by addressing some of these other areas, like career mobility, like improving the staffing ratios, improving compensation, the impact of that can be improved mental health too. Mm-hmm. So at the end of the day, all of these strategies and tactics work together to provide a more and deliver on a stronger employee experience for the nurse.
One of the questions that's come through a couple times, and I'll summarize it, is essentially there's so many things to focus on and do. Where should, if you're a leader of nurse hiring at a hospital or whatever position you hold in this world, where do you even start? Like there's so many things, and there's 5 generations of nurses that sometimes care about vastly different things. Older generations might care more about the stability and the actual compensation versus younger nurses that might care more about flexibility and career growth. How do you do all of the things? Where do you start?
Yeah, I mean, you're right. Like the CNO role in particular, along with the CHRO role, is a very dynamic role. And these are leaders that have to constantly make changes and keep up with market demands and dynamics. And then as well as like a huge employee workforce and clinician workforce that has a whole range of needs. Where we see the most success is when CNOs and CHROs start with what they can control. And what that often means is what they can implement on their own within their own teams, and frankly, things that don't require additional budget. Because as mentioned earlier, the financials at a hospital are very tricky these days, and these are organizations that are running on low margins. So first and foremost, usually when implementing things like career mobility planning and offering more career advancement programs, more training programs, tend to be budget neutral. These are relatively affordable programming and tactics to put in place that don't necessarily require additional budget. And so they're easy to implement, easier to implement. And it's one of the top, desires from nurses, both those that are already employed and those that you're trying to hire. Probably the piece after that is probably the scheduling piece, because again, that is in the control of the CNOs and the nursing managers. Now, what has to happen there is a mindset shift that has to happen among nursing managers, and that you just can't manage the workforce, the scheduling of the workforce, the same as you could 5 years ago. There's new demands, and again, that's a way for nursing and HR to work together to implement. Now, I would say that things like more compensation and offering mental health benefits and so on, those are larger budget items, especially the compensation one. And so for those ones, you have to collaborate very closely with the CFO to put together a strong business case. And at the end of the day, there is a math equation here where more compensation is playing a factor in retention too. And it's very expensive to replace nurses and to hire nurses. And so if we can do anything to improve the retention rate, those usually are relatively straightforward business cases to put together in collaboration with the CFO and the finance teams.
That's great. So we hope these retention strategies are helpful and give you a good place to start, because as you said, if we're able to retain more, that's actually going to save us money in the long term. Okay, let's shift gears a little bit. We'll tell you a little bit about Incredible Health, and then we will move on to the Q&A. And we've already addressed a lot, but there's more questions coming in. So, Incredible Health, trusted by now over 700 health systems and hospitals, which is really awesome. You can see the logos here, many of them. And really, we help these hospitals hire permanent nurses in 20 days or less. There's some that are even less than 20 days, which is really exciting. So what do? Essentially, employers apply to candidates instead of the other way around. Nurses love it. And then we're able to match and screen with our algorithms and with data nurses to positions that best suit them. That is, I think, really a cool component of this is it matches nurses with the roles that they're most suited for. And that saves everybody a ton of time. And it's probably a big part of why we can take that 90-day hiring process down to 20 or less. Is that fair, Aman?
Yeah, that's exactly right. Those are the key value propositions. I will say that this is a very candidate-centric or nurse-centric platform. You know, when you create a profile as a nurse, you sit back and relax, right? Because the employers are applying to you instead of the other way around. And if all nurses these days are highly sought after, but they're able to choose which interviews to accept and which ones to decline.
That's great, and that's a big reason why nurses join Incredible Health. So they have access to that community, but there's also a ton of free education for them, free mental health tools for them, career coaching. There are a ton of wonderful pieces of content for nurses on the Incredible Health platform that they get access to. And so we're at now, over 700,000 nurses on the platform and growing every single day, which is really cool. I think it's 25% of the nurses in the US are on the platform. Okay, 68% of RN candidates accept their first offer, and then 61% accept their first offer, even when the second or third has higher compensation. So this tells me, and you tell me if I'm reading the right thing from this, that being early is the most important thing, even more so than the compensation package in many cases. You just have to be first to the party if you're going to get a chance to work with specific RNs. Is that fair? Are there any other pieces of information that you take from this data?
Yeah, I mean, that's exactly right. We see this dynamic happen in every single market where we operate. It happens in LA and Phoenix and Houston and Dallas, New York, Miami, like every single city in this country where we're live. We see that speed and how good is a hospital and health system at their hiring operations? How quickly can they get nurses through their process and be the first to offer? That is the biggest competitive advantage. And hospitals and health systems that do that the best tend to hire more. And they hire more than the competition that has higher compensation, and they're hiring more than the competition that has even bigger brands. And so we're seeing speed and particularly as it relates to the hiring operations and operational excellence with that is the number one most important factor to hiring nurses successfully.
Where is the biggest, let's say someone doesn't use Incredible Health, what is the biggest time waster, time sucker in the process? Like, is it finding the candidate? Is it getting them through the process? Is it getting it approved? Where is the biggest time waster for most hospitals in the process?
Yeah, there's two areas where that tends to really drag out. First is just finding the nurse in the first place, so sourcing them. That's why one of the main reasons why hospitals and health systems use Incredible Health, because we really cut down the time to source from 44 days down to 3 days. But really the other area is actually the hiring manager interviews. Nursing managers are very, very busy, and sometimes it takes longer. It can take 2 weeks, sometimes to get a hiring manager interview completed. That is far too long. There are many hospitals and health systems that are able to do that in 7 days or less. And one of the benefits of using the Incredible Health platform is you get assigned a customer success manager. And we are able to share the best practices for hiring operational excellence. And there are many tactics you can put in place to reduce the interview speed for hiring managers. And that will alleviate and relieve nursing managers too. Things like allocating backup hiring managers, or allowing direct scheduling of interviews on hiring manager calendars, implementing SLAs or timelines for how quickly hiring manager interviews need to be completed. These are all examples of tactics and best practices that we're able to share with the employers that we work with. And ultimately, what we're trying to do is to reduce the days to fill. In the case of this case right here, this is a team in the LA market. We were able to reduce the days to fill from 66 days down to 19 days. And that's by sourcing faster and by automating several aspects of the hiring process and sharing best practices too.
So one of the things that we hear sometimes is people will say, gosh, if you're helping us hire so much more quickly, surely these nurses are leaving more quickly as well. Like our retention must be lower. Not true. It's actually higher. So retention is better at 1 year, likely because the role's a better match to the candidate and the candidate's a perfect match for the role than perhaps what they're used to. I will admit this one I think surprises people when we show it initially because they're potentially not expecting that, but it's true.
It is, yeah. Nurses, when you're able to have a more, I guess, thoughtful job search, where you can consider multiple opportunities, you tend to go with an employer that's a stronger match.
Yeah, and this slide just kind of drives home what we're talking about, just the process that will impact in a really dramatic way how long it takes you to hire nurses, therefore saving you a ton of money and allowing your recruiter time to actually do high skill relationship building work. So it's I think that is actually a really under discussed topic. Is this allows your recruiter to do things that are really important and are high skill tasks that they can do. Anything else you want to mention on this slide, Aman?
Sure. Yeah, we set this up as a true partnership. At the end of the day, Incredible Health only works with talent acquisition teams that are already established at a hospital and health system. And because it's a true collaboration between Incredible Health and the hospital and health system to make this work. So Incredible Health may be doing the heavy lifting in the first 4 steps of the hiring process, sourcing the talent, pre-screening them, automatically scheduling them on the recruiter's calendar. But then the recruiter that is working for the hospital and health system is taking over after that. They're completing phone screens, getting hiring manager interviews done, and getting offers sent and accepted. This is definitely a newer model in talent acquisition. All of us talk about how nurses need to operate at the top of their license or the top of their skill set. So do recruiters, so do HR professionals, right? And we need, nurse recruiters to be operating at the top of their skill set, which is engaging with talent, speaking with talent, and relationship building with hiring managers as well. It is not necessarily sourcing and doing other administrative work that frankly can be handled with software like Incredible Health. And so this is definitely a newer model. And nurse recruiters on average have 10 years of experience on our platform and in general in the US. And nurse recruiters are some of the busiest people at the hospital and health system. They average about 100 job recs each. And that is a lot of work. And so anything that can, things like Incredible Health that help like accelerate and fuel them with things like sourcing and pre-screening tends to help. It really is about quality over quantity.
That's great. All right, let's take some questions. We've taken a lot throughout, so I appreciate the number of questions that have come in. Let's just go through a few more here, and then we'll conclude. Do you have any indication on maybe how long this shortage is projected to last, based on some of the macro trends we're seeing? And then as a corollary of that, Brandon asks, he estimates there's 90,000 potential nursing students turned away because there's not enough faculty, to your point. Is there anything we can do there to increase or improve faculty and get more nurses out of nursing school? So broad macro question about the shortage, and then nursing school question number 2, Aman. I think we lost Aman, her audio. So let me address the macro question. Followed by the Aman's dialing in. That's great.
Please hold while we connect you to your webcast.
So I'll just address the macro question here.
Followed by the pound key.
First and foremost, we're estimating that it's going to take several more years. So estimates from the Bureau of Labor, estimates from us and other sources indicate this isn't a short-term thing. This is likely a long-term scenario and isn't something that's going to be solved overnight in terms of the macro shortage. The other question here that I think we're getting a few examples of and a few questions from is, Brandon says, it sounds like we're shifting nurses from one place to the other. How can we increase the number of nurses in the field? Look, I think part of the problem is that it does take so long to hire nurses that there's a perception that it's just going to be a hassle to try to go get a job as a nurse. And so that also impacts the shortage and impacts roles. So that's a big deal as well. Amon, can you hear us now?
Yeah. Sorry about that.
That's all right. That's all right. I just thought you were making a phone call. You're totally good.
No.
You're good. No, Brandon had a good question. He just asked the question about potential nursing students, that are being turned away almost because of the lack of nursing faculty. Have we heard or seen, or do you have any estimates or guesses on like why that's the case with faculty, how that can be improved, et cetera, et cetera?
Yeah, it's definitely a huge bottleneck where we have a huge wait list of tens of thousands of applicants who want to get into nursing school but cannot get in because of missing faculty and because the nursing school can't handle more capacity. It is arguably one of the biggest bottlenecks that's driving this nursing shortage. And so we've seen a few creative solutions around that. We've seen nursing schools partner with their local hospitals and health systems to essentially like borrow educators and preceptors. So you might be employed by the health system, but you're spending a little part-time working as faculty at the nursing school too. We've also seen hospitals and health systems literally acquire nursing schools and bring them into their health system too. We're also seeing more creative solutions around just increasing the number of online nursing schools and sort of more creative methods to train nurses. Now, it's difficult because this is a regulated profession at the end of the day, and certain requirements and there's very clear requirements that have to be met. But there's still a lot more work to be done to sort of alleviate that bottleneck that exists with nursing schools.
Interesting. And then are you seeing this same bottleneck or the same shortage perhaps with nurse practitioners or even like physician's assistants? Like, are you seeing, or is it strictly with RNs but what type of impact is this having in other similar adjacent roles like NPs and PAs?
Yeah, so for RNs, what we're seeing is
Yeah, we can hear you.
You can, okay. So for RNs, we're seeing that the nursing shortage is quite prevalent throughout the entire country. There's no city or state that is spared from the RN shortage. And then secondly, the shortage when it comes to NPs and PAs is actually a little bit more nuanced. So yes, there's a national shortage of nurse practitioners, but in certain parts of the country, there's more than enough nurse practitioners, and then there's other parts where there's not enough. An example of that is the state of Texas actually has an oversupply of nurse practitioners, whereas the state of California simply does not have enough. So there's definitely more work to be done there too.
So it's more nuanced maybe than just kind of the broad shortages that we see with nurses. Okay, that's great. Those are the majority of the questions. Amon, thank you for doing this. Sorry the audio cut out. I'm glad you were able to get back on. So thanks for doing this. And thanks to the Becker's team for having us. If you're interested in learning more about Incredible Health or diving into this study more, because we presented like 20 pieces of data and we have like 80. We just didn't want to take 3 hours of your life. So if you have more questions about the study, or if you're interested in learning more about Incredible Health, because we do believe we can help your hospital hire nurses more quickly and more inexpensively, and nurses that will stay longer, please reach out to us. You can reach out at questions@incrediblehealth.com or just go to incrediblehealth.com, request a demo, call us, whatever you need to do. Happy to talk to you and see if this will work for your hospital and health system. And we believe it will. So thanks again. Any final words, Amon, before we jump off?
Sure. Yeah, I mean, I think a few people were asking about the recording and the slides. I mean, the recording is going to be sent out. A member of the Incredible Health team will be in touch with all the attendees as well, with more information. And yeah, I just wanted to kind of end with hope, right? At the end of the day, like some of the stats are getting better, and we still definitely all have our work cut out for us. But at the end of the day, there's more than any other time in history, there's a desire to drive more change and more support for the nursing workforce in the U.S. And it's not just it's not just a few people that are concerned. I mean, we have the attention of the CEOs and COOs of hospitals and health systems. We have the attention of governments and the attention of media to continue to help driving and pushing for change here.
That's great. I love that we end with hope. That's awesome. Thanks for jumping on, Aman, and thanks for jumping on, everybody. We'll turn it back to the Becker's team now.
Great. Thank you so much, McKay and Iman. This has been a really wonderful discussion to listen in on, something that I know is resonating with so many folks right now. And, you know, seeing all the engagement in the Q&A section was really great to see. So thank you all for being with us during this hour. And thank you so much to Incredible Health for sponsoring today's webinar. If you'd like to learn more about the content presented today, I know McKay and Iman gave some resources, but also please be sure to check out the resources section on your webinar console and fill out the post-webinar survey. Thank you so much again for joining, and we hope you all have a wonderful afternoon.
Thank you.